welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you for joining us for Your Health, a program that keeps you informed and hopefully healthy. Joining me today from the Quincy Health Department, she is the Public Health Nurse Coordinator. I have Caitlin Pico with me here. Caitlin, welcome back.
Thank you, as always. Happy to be here.
Happy to have you. We should mention that whenever possible, we get derived topics from our viewers, and case in point, today's show.
Yes, today's show was actually requested by a Quincy resident, and as we were saying before this recording, that a lot of other communities are now watching this show as well. So if people have topics they want to see, I can definitely do some research. They can just call me. I know later on we'll have my number.
We'll have your number on screen for folks throughout the program, so certainly they can get in touch with you that way, send you an email, and you'll cover that as well.
Yes.
Very good. So today's topic, scleroderma. And before we get into the topic, let's look at the overview so both I and the viewing audience will know what to expect. We will start with a definition. What is scleroderma? We will talk about forms, facts, symptoms, living with it, and resources available. So definition, always the best way to start a program.
Yeah, so this is a very in-depth topic. So I'm going to do my best to review this information. And according to the National Scleroderma Foundation, it is defined as a rare autoimmune disease which affects connective tissue in the vascular system, producing excess collagen, which causes fibrosis in the skin, which can be localized, or it can also cause this fibrosis on internal organs, which is systemic sclerosis. So we'll get a little bit more in depth into the different forms.
We're going to look at the origin, because I'm always curious about these illnesses, these diseases.
So the origin of the name, so the word sclero comes from the Greek word which means hard, and the word derma is a Latin word which means skin. So one of the manifestations of this disease would be hardening of the skin. One important thing to know that it is not contagious and it is not malignant, but anytime as a nurse, if anybody has a skin abnormality, of course you want to check with your healthcare provider or dermatologist, because you want to make sure, one, it's not cancerous, but you also want to figure out what's going on and how you may be able to treat it.
I know in previous programs we've discussed how various organs of the body, the skin is the largest, is that correct?
Yes, it is the largest organ, and it works as a barrier to keep out infection and bacteria. So definitely any conditions with the skin, you want to make sure you are consulting with your physician to know what's going on with your body.
I'm glad you said that, because a lot of folks now with the internet self-diagnose, and that can be dangerous.
It can be very dangerous, and it's important to know. I was listening to a podcast, actually, an educational podcast on scleroderma, and they were saying when a patient got the diagnosis, the doctor said, don't go Google it, because there's a lot, and it affects everybody differently, as with a lot of autoimmune diseases. So it's kind of tough, because not every single symptom or not every single condition is going to affect every patient that is diagnosed with this condition.
Let's look at forms. We'll begin there.
Yes, so there are two major classifications of scleroderma, and this would include localized and then systemic scleroderma. So first we'll start with localized. So this is also into they kind of do two sub-classifications of this. And it is important to know, a lot of my information again is from the National Scleroderma Foundation. There is still a lot of research being done about this, so this could down the line, they could find more classifications. So people with this condition are not always going to fall into these categories perfectly. But with localized scleroderma, it is classified. So the first one is called morphia. And this is characterized by waxy patches of skin that can vary in the size, shape, and color. These patches may thicken, may enlarge or shrink, and some people might even have them spontaneously go away and then reappear. So this form can be seen in young children, but it usually can appear in an individual between the ages of 20 to 50 years old. And then the next form we have is linear scleroderma. And whenever you think of linear, you think of a line, of course. So in this form of also localized scleroderma, they might have, it's a streak or a line of the hardened, waxy skin. A lot of times this form will be found on the arms, legs, or forehead even. You do often see this in young children, and it's important to know that with this form, if it develops over a limb, as the child grows, that limb can be affected. So it's just important to know that.
Looking next to systemic.
Yeah, so systemic scleroderma, this is also known as systematic sclerosis, is another word for it. And this is also, it affects the connective tissues in many parts of the body. This could affect your entire body. So it can affect your lungs, your heart, your GI tract, your eyes, even your brain, so your mental health. So we'll go a little bit more into that when we go over symptoms, because we'll talk about how, depending on which organs in your body are affected, how you may have different symptoms with this. But you want to think with any sort of organ in your body, of course your organs are there to perform tasks, such as your heart pumps blood throughout your entire body. If you have hardening of that heart muscle, of course it cannot perform as well as it's supposed to.
Because it's not flexible.
Yes, yes. So, and again, there's a lot of information with this topic, so I'm going to try my best to review it as well as possible. But there are two recognized patterns of scleroderma. The first one is diffuse, and in diffuse scleroderma, the skin thickening may occur more rapidly, and it may affect more areas of the skin. And for individuals that do have diffuse scleroderma, they are more likely or at a higher risk to have it affect their internal organs. But then with the limited scleroderma, this has a slower progression. So they say it's a benign condition, so it's less harmful. And the skin thickening can happen mostly on the fingers, hands, and face, and it progresses over years. So although somebody with limited scleroderma can eventually have the internal organs affected, you more would see that over years and not a quick. With the diffuse, it might be a quicker ongoing of this. It may more rapidly spread throughout your body.
Does it have to start at the surface before going internal?
So not always, not always. And that's what makes this very difficult, because if you go to the doctors with shortness of breath, their first thought might not be scleroderma. So a lot of times with this autoimmune condition, it can go underdiagnosed because it can, of course, the body is very complex, so it may be hard to pinpoint where that symptom is coming from. So it's a lot of trial and error and ruling out different conditions.
There's a syndrome called the CREST syndrome. What is that?
Yeah, so limited scleroderma can often be referred to as CREST syndrome. And this, the CREST, the CREST. It stands for the 5 common features. And again, not every patient's going to have every one of these. But the first one we have is calcinosis, and this is a disorder characterized by deposits of calcium in the skin or subcutaneous tissues. Next, we have Raynaud phenomenon, and this occurs because there's an inappropriate or exaggerated contraction of small blood vessels. So your blood is not traveling as well. A lot of times this will affect your fingers and toes, your peripherals, because again, that's the furthest part that your heart is pumping to. So a lot of times people will experience this. And basically what happens is in cold or even in a stressful situation, it can happen. And the person would experience like pallor, so color changes. Your fingers might get really cold. It can be very painful also. So that's like one thing that we do see. Raynaud's phenomenon doesn't always mean you have scleroderma. Of course, other conditions can make you have that as well. So now for E, we have esophageal dysfunction. The most common type we see is GERD. So if you think of that, your esophagus, if that is hardening, you're going to have difficulty swallowing food. You may have acid reflux. So that's a lot of individuals will experience those symptoms. Next we have sclerodactyly, which just means skin tightening. And then this last one, I am probably going to pronounce it incorrectly. It's telangiectasia. I apologize if I mispronounced that. But basically what this is, it's also known as spider veins. And it's small, widened blood vessels in the skin. So a lot of times you'll see that on your legs, or some people will have it on their face. A lot of times it's not a cause of harm, but there's always an internal reason as to why the body is then getting those spider veins. So those are the 5 manifestations that you often see with scleroderma.
We do have one photo, and I will hold it up, but it will be on screen full size.
And in that image, it just shows the individual's hands are very red. They look painful.
Almost leathery.
Yes, yes. And it just kind of shows what an individual may experience if they were to get diagnosed and were to experience this.
Next, we're going to look at some facts.
Yeah, so I think I already mentioned this, but localized scleroderma can be more common in children, and systemic scleroderma tends to be more common in adults. And according to the National Scleroderma Foundation, females diagnosed with scleroderma, the statistic is 4 to 1. So 4 females for every 1 male that is diagnosed with this condition. They do believe race and ethnicity may determine your risk of developing scleroderma in the future. And then also, although they don't know if there's an inherited link, like a family history, scientists do believe that there's a predisposition in families that have a history of rheumatic diseases.
And again, quite an age range, basically from young to old for this illness.
So anybody can really experience this. I know there's a lot of information we're throwing at people right now, but it really does affect everybody differently. So as with all my shows, I really say contact your healthcare professional, and you have to really work with a full team to help manage your symptoms and help slow the progression of this autoimmune disease.
And you mentioned symptoms, so why don't we go there next?
Yeah, so this is actually a very large section of notes that I have for symptoms, because again, it depends on what organ systems it is affecting in your body. So it varies greatly from person to person. Symptoms may be visible, especially if you have localized and it's affecting your skin. But some individuals may have invisible, where it affects the internal organ. So like if you saw the person, you wouldn't realize they had it. So now I'll just kind of quickly go through different body systems. So again, with the vascular system, so this is the vessels and tissues that circulate blood throughout your body. This is the most common involvement in scleroderma, and it's that Raynaud's phenomenon again. And this is actually seen in 90% of patients, the Raynaud's phenomenon. So it most commonly, again, affects your fingers and toes, but many people could also see it in your ears, nose, and the tip of your tongue. So there's a lack of blood flow to these areas, so it again changes. Skin color changes. You may have swelling, tingling, or numbness in your hands. So the best way to deal with the Raynaud's phenomenon is you want to limit your exposure to cold. So especially as the winter months are coming up, make sure you have gloves if you're going outside. Another thing is if you do have this phenomenon and your fingers are white, it could be painful. Never put them in hot water. You want to start with like a warm water to run your hands under to warm them up. Because if you think of it, if you don't have that blood flow and you're having numbness, if you're putting it under steaming hot water, you could burn your skin very easily. So that's just one thing I want to point out. Be careful trying to deal with it. I know my first instinct when I'm cold, I want to take a hot shower. Make sure the heat's not too much because you don't want to hurt yourself.
So you're almost better off wrapping.
Yes, and definitely layers. With the winter, layer up. They do say that it can be extreme for individuals, so it might not even be that cold out, but you could get the coldness like right away. And a lot of times you will notice the tingling and the color changes. So just know your body. Have gloves on hand if necessary.
Oral, facial, and dental problems.
Yes, so this is kind of with the skin tightening. So if you think of it, if you have skin tightening on your face, some individuals don't have the full movement of their mouth. So if you think of that, it will cause difficulty in your everyday activity. It could be harder to eat, harder for dental care, for dental hygiene. So one thing they did say with this is you might want to do daily exercises, but you want to consult with, for example, your dentist. Your dentist knows the face, all the muscles in your face. So you want to make sure you're not doing something that's going to cause more harm to your body. So you want to be collaborating with your dentist, staying in close touch so they can kind of monitor you. And if it worsens, they might want to see you more often to make sure your dental hygiene is also keeping up to date. So now we have the musculoskeletal system. So again, with the hands, you might have swelling or puffiness in the hands. And a lot of times you might experience this first thing in the morning. Same with arthritis. It might be worse in the morning because you're resting all night. So another thing with this, your physician may do over-the-counter remedies to help with the inflammation, such as aspirin or Tylenol. But I always say, as a nurse, anything when it comes to medications, check with your doctor because you never know if you're on something else that could interact with it. But they also, for this, they may have exercises as well to do daily because it's one of those things if you don't continue to exercise, the stiffness can continue. But again, you want to make sure you're contacting your physician. They could also be a physical therapist you're working with to make sure you're doing the correct stretches that will help you and not hurt your progress.
Right. Pulmonary.
Yeah, so with systemic sclerosis, if there is thickening of the lung tissues, again, this is going to inhibit the oxygen flow in your blood. So these individuals might have shortness of breath, decreased tolerance for activity, and even a persistent cough. So that's very important, and again, you want to make sure you're really staying close with your healthcare team to manage these symptoms.
And I know we've discussed this organ quite a bit in this program already, but the heart.
Yeah, so same with the lungs. If your heart muscle cannot pump, it's going to inhibit every body system because the blood and oxygen will not flow properly. So these individuals will have even the shortness of breath, the reduced ability to do your everyday activities. So you want to make sure that you're really continuing to work with that healthcare team and doing your daily activities to make sure you're doing the best to help slow the progression.
And another organ that you had highlighted earlier, that would be the brain.
Yes, and this was, I thought was very important. With any chronic illnesses, especially with scleroderma, that can really inhibit your daily lifestyle. Even when we mention oral, like hygiene, how we learn when we're little kids how to brush your teeth. So if you think of it, and it's
My 18-year-old hasn't learned that yet.
yeah. So yeah, it can be an ongoing learning thing. But if you think of an individual, if you lose your ability to do something like brush your teeth, it might be harder to hold your toothbrush or open your mouth. That is really going to affect your mental health. So a lot of individuals can have anxiety and depression. So you want to make sure, as part of your healthcare team, maybe you would see a psychiatrist or a mental health professional, because it's not easy, these lifestyle changes, especially because you kind of can lose your independence if you don't have the ability to walk and all of that. So it's very important that your brain health, your mental health is a big part of this, and you want to make sure you're staying on top of that, because it's very easy to feel anxiety and depression if you're going through these lifestyle changes.
Absolutely. The GI tract.
Yeah, so the GI tract, people may experience that heartburn, difficulty swallowing, bloating, constipation, because again, you want to think of your muscles in the GI tract from your esophagus all the way down to your intestines. It contracts to get the food down and to break down the food. So your body can't do that as well if the GI tract is involved. So again, a lot of treatment would be going towards helping address those concerns, like helping addressing heartburn and all of that, because it really does interfere with your daily, everyday life.
And again, just continuing, kidneys, eyes as well.
Yeah, so at this point in my research, I really just wanted to refer people to the National Sclerosis Foundation website, and that is just the National, it's actually scleroderma.org, because it goes, as you can tell by my information, it goes so in depth, this autoimmune disease. So I really just wanted to refer people to that to find out some more information, or contact your doctor, your specialist, to figure out some more information.
Very good. And lastly, we're going to look at living with scleroderma.
Yes, so treatment plans are individualized because, again, it affects everybody differently. A lot of medications that are prescribed, they can help manage the localized symptoms. For example, a lot of topical treatments may be used. Also, systemic medications, they may have medications to help reduce the inflammation. And then also there are other medications to, again, treat those symptoms that are affecting your quality of life, including the stiffness or pain in your hands and your joints, or the GI problems such as the acid reflux. So you want to make sure you're really working closely, again, with your healthcare team. I know that's my favorite thing to say. But it's not a one thing fixes all. And they're still doing a lot of research on this condition, as with a lot of autoimmune diseases, because there is no cure. It's kind of more, how do you manage those symptoms, and how in your everyday life can we make it easier for you? So we, again, with that healthcare team, it's not just your physician. It could be your physician, also your dentist, an occupational therapist, a rheumatologist, which specializes in immune-related diseases. It's a big collaboration.
Another reason to stop smoking?
Yes, and because if you think of the negative effects of smoking cigarettes, that can lead to constriction of your arteries and your veins, so that also prohibits the blood flow. So where scleroderma in its own is going to constrict the blood flow, stop smoking is always something I love to say and love to inform people on. And then the biggest thing if you are diagnosed, or if you have a loved one that's diagnosed, there are support groups and educational information, again, on that scleroderma.org website. And I loved that website because it goes into local resources, national resources, because this foundation's amazing, and they really do a lot of research and a lot of walks and things like that to raise money to research this, to help fully understand this condition.
Well, very good. I thought you did a great job bringing this topic forward for folks, informing both me and the folks out beyond Quincy and beyond. And we want to certainly thank, so I thank you, and I thank the viewer for suggesting this topic.
Yes, and I hope I covered it. I know there's a lot of information here. Again, I'm really pushing that website because wealth of knowledge. It's very clear cut. They have it whether you're a healthcare provider or if you are the patient or the caregiver. There's so much information on how to help yourself and how to help your loved ones if they're the ones dealing with this.
Well, as we close, and we'll keep it on the webpage, we'll keep it on the screen while I mention this, but 617-376-1286 or quincyma.gov if someone would like to reach out with any questions on this topic or any additional, or seeking any information about other topics that we haven't discussed.
Yes. As I always like to say, I am not a specialist in this condition, so there is a lot of information I may not know on this. So I always recommend reaching out to your physician, looking at that website, but I always do my best I get the information off the state website, anything.org, the foundations, for example here, the National Scleroderma Foundation. So I try to get the most uniform information to provide to the viewer.
Very good. Well, thank you again for sharing that, and thank you at home for watching this program. We certainly thank all of you out there throughout the country, really, for tuning in, and we'll see you on a different day with a different topic. Thank you.